Medical assistance in dying is an extremely difficult and personal issue for individuals and families. As a government, we need to make sure that the framework and the resources are in place for people to make informed and proper decisions.
It can take dying to figure out what living is actually like.
The federal government calculated the cost of expanding government-assisted homicide to people suffering through our socialized healthcare system beyond those Canadians who are terminally ill and whose deaths would occur in the foreseeable future. The feds estimated they would save $149 million in the healthcare system by dispatching Canadians early. Canada's Medical Assistance in Dying, or MAID law, Bill C-14, was first passed in 2016. And initially, it was just for people who are terminally ill and whose deaths were nearly immediate. For many, the artificial hastening of their death would amount to a shorter life of about 2 weeks. But many people said that C-14 was a very slippery slope that would not stop at the terminally ill, and is so often the case these days. Life has become a bit of a slow motion. I told you so. Because soon after, along came Bill C-7, which expanded medical assistance in dying and rolled back many of the safeguards in the original version of the law. MAID has now been expanded to people who are chronically ill and dissatisfied with their care in Canada's rationed public healthcare system. And as of March 2023, the law is going to be further expanded to allow people who are mentally ill to access MAID, which no longer, by the way, has to be performed by a doctor, but can be performed by a healthcare professional, including a pharmacist or a nurse. And in some instances, the 10-day wait period for MAID has been revoked. Instead of offering people help and better access to care and proper services, they're getting a homicide at the hands of the state. If you'd like to sign our petition to the health minister calling on him to offer suffering Canadians the quality care they deserve instead of a helping hand from this life to the next, please consider visiting helpnothomicide.com and signing our petition. Now, way back in October 2020, the Parliamentary Budget Office of the federal government did a financial analysis of expanding medical assistance in dying as Bill C-7 was proposed to expand medical assistance in dying to the chronically ill. This ghoulish liberal federal government had the Hitlerian compulsion to do a financial analysis of just how much killing our grandparents and the depressed and the chronically ill around us would save the collapsing Canadian healthcare system. Makes me sick to even think about it, but somebody did think about it, and then they did the math. And now I have those documents to show you. You're going to see them today, but before I show you these horrific documents, this isn't the first time that this sort of analysis has been done. In 2017, CBC, without an ounce of irony, trudged up some similar monstrous analysis on the financial savings to be reaped because of the complete and utter disposal of human life as dispensable and valueless. Look at this. It's chilling and cold and clinical, and it feels like it could have been uncovered in a pile of documents at Bergen-Belsen. Doctor-assisted death could reduce annual healthcare spending across the country by between $34.7 million and $136.8 million, according to a report published in the Canadian Medical Association Journal on Monday. The savings exceedingly outweigh the estimated 1.5 to 14.8 million indirect costs associated with implementing medical-assisted dying. My takeaway point is that there may be some upfront costs associated with offering medical assistance in dying to Canadians, but there may also be a reduction in spending elsewhere in the system, and therefore offering medical assistance in dying to Canadians will not cost the healthcare system anything extra. Said Aaron Trachtenberg. I wonder if he said it in the original German. He's the author of this evil 2017 report and a resident of internal medicine at the University of Calgary, and probably not somebody I would like to see if I were chronically sick or terminally ill, that's for darn sure. So the idea of breaking human life down into just dollar figures in a socialized Medicare system where suffering, delays, and lengthy wait times, and a lack of access to real care, well, those things are all the chronic state of the system, and it's absolutely nothing new for us Canadians. But that analysis was done by a medical association journal. And those people have been letting us down for a very long time, especially if you look at how they have coached society on proper nutrition over the last 50 years. But especially these medical institutions and journals, they've really failed society in the last 3 years of the COVID-19 pandemic, haven't they? But it was really something else to see the federal government, a government that wastes money on literally everything, come up with these numbers. And so I'm going to show them to you now. Bill C-7 aims to expand access to medical assistance in dying, MAID, for patients whose death is not expected in the relatively near term. At the request of a senator, this report presents an independent cost estimate of Bill C-7 for 2021 by providing a breakdown between the baseline costs under the current legislation, Bill C-14, and the incremental costs from expanding eligibility under the proposed legislation, Bill C-7. Now, this has been expanded. We are operating under the Bill C-7 protocols. Please remember that this analysis was done in 2020, and it was designed to look into the future. Let's keep going. Summary Table 1 presents the net financial impact of providing MAID in 2021 under the current legislation as set out in Bill C-14, which is used as a baseline for the cost estimate. The predicted gross reduction, gross being a correct description here, in healthcare costs amounts to $109.2 million, while the cost of administering MAID is estimated at $22.3 million. Thus, the difference between the two represents a net cost reduction for provincial governments of $86.9 million. Summary Table 2 presents the incremental financial impact of expanding MAID as proposed in Bill C-7, which, as you know, Canada has already done. The gross reduction in healthcare costs is estimated at $66.5 million. As can be seen, even though the number of incremental MAID deaths is 82% smaller than the number of MAID deaths under the current legislation, the gross reduction in costs is only Summary Table 1 cost estimate for Bill C-7, medical assistance in dying, 24% smaller since newly eligible patients under Bill C-7 are expected to initiate MAID earlier. The cost of administering MAID is estimated at $4.4 million, and thus the net reduction in healthcare costs for provincial governments will amount to $62 million. So these ghouls add the numbers of savings together and voila, $149 million saved by killing Canadians early. But here's the thing. These analysts have vastly underestimated the number of people willing to seek government homicide because of a government-created lack of access to timely care and palliative help. So the original estimate for 2021 of people who would access MAID under the previous C-14 protocols was 6,465 people. And expanded, they estimated an additional 1,164 people would access MAID under the new C-7 protocols. So all told, in 2021, if they change the law, 7,629 Canadians would access medical assistance in dying. But in reality, the number of people who accessed MAID was about 3,000 souls higher than their icy clinical estimates. 10,064 people chose government help to die in 2021, an increase of 32% over the year the analysis was completed. An extra 3,000 people chose to end their lives, then prolong their suffering in our healthcare system. And instead of fixing the healthcare system and providing the services we should be providing to struggling, suffering Canadians, the government is just continuing to make it easier for you to do your so-called civic duty and get out of the healthcare wait lines by whatever means necessary. For Rebel News, I'm Sheila Gunn-Reid. If you'd like to sign our petition calling on the health minister to offer people the help they deserve instead of medical assistance in dying, please visit helpnothomicide.com.